start in 10, 9, 8, 7, 6, 5.
Hi, everyone, and welcome to our virtual conversation about the pandemic. We're talking about everything tonight. We're covering the vaccines, we're covering the treatments that are being used to take care of patients, and we want your mental health questions. We have experts from covering all of those topics. Of course, we are so lucky to live in Northeast Ohio because those experts are just a phone call away. So let me introduce to you our panel. From University Hospitals, we have Dr. Robert Salata. He is Program Director for the Roe Green Center for Travel Medicine and Global Health. He's also the chair of the Department of Medicine, an infectious disease expert, and he is the principal investigator for the Pfizer vaccine trial at UH. From Cleveland Clinic, we have Dr. Abhijit Duggal, who is a critical care physician specializing in pulmonology and treating COVID patients. And from Metro Health, we have Dr. Shirley Ratner, who is a psychologist who handles mental health issues for children, adults, and seniors. And last but not least, my partner in crime tonight, we have David DeNatale, who is my partner. He's handling these amazing questions with us as well. And we are going to try to get through as many questions as possible in the next hour. So we're going to hop around and just jump around these topics because we have so many questions. Dr. Salata, though, I have to start with you. Big news today. The advisory panel who was looking at the data from the Moderna trial has now given their approval, and they're telling the FDA that they should sign off on this. What does that mean?
So that's also very exciting news, Monica, because this now brings two vaccines to the forefront in terms of its use as we go through the priority populations for those to get the vaccines in general. But what it means now is after that first hurdle, and prior to that, the staff at the FDA had also provided a lot of information that was utilized during their review period today. And they were also highly laudatory. And the vote was actually 20-4, 1 abstention, and I believe the abstention was because they were involved in the Moderna trial. So it was unanimous in this regard. The next step is that the CDC director, Dr. Robert Redfield, will turn this around quickly and approve this. We anticipate that will happen. And as well, the advisory committee on immunization practices, I should say, who report to the CDC will make their own judgment, and that will happen on Sunday. In the meanwhile, we expect the Moderna vaccine to start rolling in the trucks and in the planes even this weekend. And that will really increase our capacity to start vaccinating, particularly in two initial groups. That is healthcare workers on the front line, as well as residents and their caregivers in long-term care facilities. But that's how it's initially being rolled out. I would also anticipate that, like the Pfizer recommendations have come about, that they'll make statements about vaccinating pregnant and breastfeeding women, even though they have not been studied. We do know in animals that the mRNA component, which is part of both vaccines, does not cross the placenta. And also, it's a killed vaccine, not live, which we generally avoid in pregnant women. And also the safety profile is such that it has been decided for the Pfizer vaccine, and I expect this to happen also with the Moderna vaccine, that will allow women who want to be vaccinated that are pregnant to receive it after a informed discussion with their caregiver. The same will happen likely with those that are immunocompromised, although in that group, the efficacy rate, which in otherwise non-immunocompromised patients or individuals, was on the order of 95% for both. So we'll see what happens as we move along, but that's just terrific news as well.
All right, Dr. Dougal, I want to move on to you. Donald says he had a mild case of COVID in October, but he still has lingering fatigue symptoms. What should he do about that?
Yeah, so this unfortunately has been a issue with a lot of patients who've been infected with COVID. Like, we really don't have a good understanding as to why some people have some of these lingering features. It's being studied in terms of looking at these patients at 1 month, 3 months, and 6 months after the COVID infection. And there does not seem to be a direct correlation with infectivity with these lingering symptoms at this point of time. What this is most likely is because COVID is associated with a high amount of inflammatory surge in the body. So in some patients, what we might be seeing is that there is lingering inflammatory processes that we really don't understand right now. There's a bunch of trials that are going on right now that are perhaps looking at these options in terms of whether this is just an inflammatory reaction of the body, whether this is something that's got to do with a higher rate of clotting that has been seen in these COVID patients. But we really don't have any conclusive answers at this point of time. We at the Cleveland Clinic are involved with a bunch of these trials through the PETAL network, and hopefully we'll have the answers by early next year in terms of if there's any patterns that we do see with these long-term symptoms in these patients.
And Dr.
Yeah.
Salata,
Yes.
can you talk about the clinic?
Our clinic. So we are setting up a post-COVID clinic. And one of the terms that I don't like personally, but has been applied to this group are the long haulers. I think we'll get a better name going forward, but this is meant to be multidisciplinary in nature because many of these symptoms, which include lingering pulmonary symptoms that Dr. Dougal probably will be seeing, fatigue, also rheumatologic conditions like muscle pain and joint pain. And in terms of the nervous system, there have been described brain fog, which is one of the common terms that's used, and other problems with neurocognitive capability. So we are setting this up as is happening around the country, and it will really take a multidisciplinary approach. And as at the clinic, we will have the opportunity to enroll these patients in therapeutic trials to see if anything mitigates this problem. So generally, we use 12 weeks as the period where we call them long haulers, but certainly persistent symptoms beyond the first several weeks have been well reported.
Dave, I'm going to hand it over to you for our questions for Dr. Ratner. It's the holidays. Mental health is always an issue at this time. I know you're getting a ton of questions about that.
Yeah, and it's funny. We wanted to do this panel. We had our first town hall for mental health in September. We said, boy, holiday season's coming. Coronavirus is still an issue. We got to do another one, and obviously we're expanding it with everything going on with the vaccine. But Dr. Ratner, let's bring you in on this. Most of us have been in this survival mode going all the way back to March. So we're talking what, 10 months, 11 months, whatever. We're exhausted and we've got to get through the holiday season. But with isolation an issue, how do we do that? How do we get through what is already a fun but stressful time in isolation and get through the mental challenge of that?
That's the $1 million question of this winter, isn't it? I think to start, even us sitting together and asking this question collectively is already comforting, because we know that we're all in this together. And I think that in times of uncertainty to this extent, and where many of us are feeling extremely lonely, some of us are grieving, some of us are scared. We want to know that we're not alone. So I want to reiterate that we are asking this question together and that we are in this together. And so I'm going to take a little bit of the wrong route to get to the answer, but that is to say, knowing that we're asking the question together, that we're in this together, that we want to make sure that we reach out to each other, and that is critical. One of the things in psychology that I find that is really important to stress to people is that we often think, or we're socially, trained to think that if I feel good about something, then I'll do it. And if I don't feel good about something, I won't do it. In times like this, it's very important to be counterintuitive and to say, I'm going to do something, even if I don't feel like doing it. And by doing it, the good feeling will come. And I'm going to give some examples. It is very, very critical that we shift our mindset right now from, I will do this when I feel good. No, if I'm lonely, then depression gets worse. When I'm lonely, I'm going to socially isolate. I don't really want to talk to anybody. I don't feel like it. And that takes us into this vicious downward spiral. So what we have to do is say, no, I'm going to do this. I don't feel like doing it. I'm going to do it anyway. This holiday is particularly important that we do it. I have many patients who say, I don't feel like putting my tree up. What's the point? Put your tree up. I've had patients who've forced themselves, but once they put up their Christmas tree and put the lights, something lit up in their hearts and they felt better. So do, and then you will feel. So I would say that is the start to how I want people to shift their mindset. I don't really feel like connecting with people on Zoom. I'm having Zoom fatigue. Set up that Zoom meeting, connect anyway. You will feel better afterwards, even if you don't feel like it in the moment. Very critical in times of uncertainty.
So what I'm hearing from you is keep those traditions, but just tweak them a little because of the pandemic.
Absolutely.
That's great.
Be a doer, Monica. Be a doer.
Dr. Salata, I'm going to circle back to you. Larry wants to know if people will need an antibody test after they get the vaccine.
I think in most cases, because of the data that we know, that's not going to be necessary. They may need it for peace of mind to assess whether they responded appropriately, but rates of 95% are pretty impressive. And this rivals other vaccines that have been so considered to be incredibly effective. And that is things like measles, mumps, rubella, or even tetanus. So these levels are generally not seen. As we've discussed before, Monica, we were hoping at the FDA, CDC, NIH level, National Institutes of Health level, if we achieved a efficacy rate of around 70%, that was damn good. This is even better, beyond our wildest dreams. So with that, it's going to be, a personal choice. But one group that I would recommend doing antibody studies in, following the second dose and probably at least 10 days afterwards, would be those that are immune compromised, where we expect their rates of response to be much less. And therefore, that would be another important message, not only to them, but their caregivers in terms of their continued risk for COVID in that context. They, like the pregnant women, should be counseled and make a decision along with their caregivers about whether they want to pursue this. The more immunosuppressed they are, the less likely they are to respond. So I think that group for sure, in my view. The same has been said by some in the context of pregnancy, but generally women who are pregnant are somewhat, we consider, immune compromised. I think for peace of mind, they may want to consider it. But in our own trial, we had individuals on their own go out and get their antibodies tested. And then they would try to report that back to us, but we were blinded, so we didn't want to hear it. But I think that's another issue that will come into play. For all those that participated in the trial, their antibody status after vaccination will be made known to them. So we're going to have that as well. But for anybody else getting vaccinated, that's going to be a personal choice, I think.
Dr. Dougal, I had a ton of questions about various treatments. I want to throw out I think it's a local antiviral spray, the Halo spray. Are you familiar?
I'm not, no, unfortunately.
Dr. Salata, are you familiar?
I am, and I was going to be the principal investigator on that trial, mainly as a preventative in healthcare workers who had constant exposure, but the FDA would not allow them without certain other studies to proceed. So we never got that one off the ground, but there have been other trials, I won't go into great detail, that have used a similar approach, either with mouthwashes or intranasal sprays that really are effective against this virus. And whether that can be used certainly as a preventative is really the main issue here.
Would you recommend that for people who have access to it?
Right now, this is being given in the context of a clinical trial. So I think that Halo is available over the counter. If they wanted to do that, that's up to them. But right now, it's not been studied appropriately, nor do I think it will be harmful in my view.
Dr. Dougal, I'll go back to, I had a number of people asking about, could you please explain the monoclonal antibodies, the Regenerons and the Eli Lilly medications? And I had Sharon wanted to know, with all the people in the ICUs, why aren't they getting those drugs, or are they? And would these types of drugs help lessen the overcrowding and deaths in hospitals? So first, let me separate this, because everybody had, several people had asked if you could explain what these medications are, what the president, Rudy Giuliani, received. Is that available to the general public if they need it? And are those the answer to helping getting people out of the ICU and back home?
So monoclonal antibodies, we've been studying them in different diseases before COVID came about. So a simple way of thinking about it is that what you're doing is, with a monoclonal antibody, you're taking someone who has been infected, someone who's been exposed to something, and you're now using their plasma and other things to develop things that can now go and either upregulate your immune system or downregulate whatever is happening because of the virus connecting to different cells in our body. By disrupting either one of those chains, or by enhancing your ability to fight things, you will be able to kind of be more effective in terms of getting, being able to heal from the disease process itself. Now, Regeneron's on everyone's mouth because of President Trump getting it, but Regeneron's not the only monoclonal antibody in the game. Right now, there's a number of trials that are going on that are looking at different monoclonal antibodies. So one thing to remember is that under the Human and Health Services, there's a process called the Operation Warp Speed that is looking at multiple monoclonal antibodies, both in outpatient settings and in inpatient settings, to really see if we do see an effect. Now, the question really becomes, when is the right time to give that medication? At least based on the preliminary results that we are seeing, the earlier that you use these monoclonal antibodies, the better is the results that we are seeing. So if you're able to get these patients in the early phases of those diseases, as is the case with President Trump, Rudy Giuliani, where these were introduced much earlier in the disease course, it seems to have a pretty good signal in terms of terminating things progressing. Once you are sick enough where you are either hospitalized, where you're requiring a lot of oxygen support, if you are very sick where you come to the ICU, the effectiveness is not really being shown. So like I said, we are studying these. So there is multiple trials that are going on right now. We finished one trial looking at monoclonal antibodies in inpatient setting. and we're getting ready to start a second one with two new monoclonal antibody agents. But again, like we've not really seen much of a positive signal in patients who are very sick. And because of that, the question about, hey, if we start using it in a lot of our inpatient settings, would we really change the burden of disease for these patients? Does not seem that that would be the case. Once we are sick enough and we are coming and getting hospitalized, I think we've not really seen that much of an effect with these monoclonal antibodies.
All right, Dave, I'll hand it over to you.
Yeah, Dr. Ratner, I want to hit on, we've heard from people who actually have had mild cases of coronavirus. It's like this uncertainty anxiety, so to speak. Either somebody has a cough and they've been tested and they're waiting on results and they're anxious and their mental health is being challenged, or they have it, but it's a mild case. Maybe they've lost their sense of smell or taste, but not something where they've needed to be hospitalized or in an ICU to that point. But they're obviously, from mentally, they've put themselves into that position where, oh my goodness, that's where I'm going. How can we combat that uncertainty anxiety, I guess is the best way I could put it?
Yes, that is very much that's an excellent question. And, I'm a health psychologist and I work in the Department of Family Medicine, and we study the mind-body connection, and everybody knows today there's so much research to show the extent to which the mind-body connection is critical. And we see the extent to which people who have medical health issues, their symptoms and their conditions get worse if their mental health is compromised. So this is very real. And for people who are very anxious and develop anxiety, panic attacks, or panic disorder around this pandemic, which is very normal that it's been happening, we do tend to see people feeling very anxious about their symptoms, which could exacerbate it. It could exacerbate their breathing. It could, really exacerbate their inability to they become paralyzed. We become paralyzed, and so emotionally and physically. And that is not good. And so I want to suggest to people, that the way our brain works, right? We are, as you mentioned, we are in survival mode. When we are in survival mode, when we're in uncertainty, what happens to our brain? Our executive functioning, our thinking brains tends to shut down, and we go to the primitive part of our brain, which is fight or flight, right? And that's not where we want to be, but that's often where we are here. How do you combat that fight or flight response so that you can get through this illness and or just the situation that you're in a way that you can minimize the impact? So one of the ways that we talk about is, first of all, we want to encourage people to do it, because if you don't do this, if you don't find a way to minimize your anxiety, you're going to make things worse for yourself. So if you are in your reptilian brain afraid of the danger, you are going to put yourself in more danger. So right. So sometimes we need to remind people and motivate them based on don't put yourself in more danger. One of the ways that we help patients is through mindfulness techniques. Those have been shown to be very, very effective in reducing anxiety and helping people to manage, as you say, what we call anticipatory anxiety, or worrying about something that hasn't yet happened and may never happen, right? That's called anticipatory anxiety. Mindfulness, deep breathing, meditation are some of the ways, and there's certainly, we could talk more about mindfulness meditation, and I'm sure I know that Monica has provided some of those on the website. But the key is the quickest way to reduce your anxiety, that is something that you could do anywhere, anytime, in any situation. Guess what? I know you know what it is. Come on, Monica.
Breathing.
That's good. Breathe.
Breathe, right? Breathe. Okay, so we all breathe all the time, right? Most of the time we don't think about it, but the research has shown is the quickest way to bring down your sympathetic nervous system down is through a deep conscious breath, and relax your body. That's number one. That's the gateway. You really cannot get anything done or think clearly. You're trying to get your reptilian brain to come back to your thinking brain so you can think rationally. A deep breath starts there. So that's just a start. And then we can go from there as well. But just to start.
And working in a crazy newsroom, I can tell you I do it daily, and it definitely works.
Right.
So, and I know Dave does it as well.
Oh, yeah.
I've seen him. Dr. Salata, let me go back to you. We were talking about one of the things a lot of people have concerns with is the fact that we're now hearing of healthcare workers who have received the vaccine having severe allergic reactions. Are there people who should not get this vaccine because of it? And, what do we need to worry about? Because so far, all I've seen are 2 cases in England and 2 cases in the US so far. There may be more, I'm not sure. But what's your advice relating to the allergic reactions?
So far, that's been reported with the Pfizer vaccine, just to be clear. And we'll see if that ensues with the Moderna vaccine as it's introduced more broadly. And in the 2 first cases from the UK, these were individuals that came into this with already a history of very severe reactions to a variety of things, including medication, other medications, not necessarily vaccines, injections, et cetera. So the posture that the UK took was to dissuade those with, quote, severe allergic reactions from receiving the vaccine at this time. We are awaiting further guidance, especially from our allergist and immunologist in the United States. But the CDC says that if you know you're coming into this, that is to be vaccinated with a severe allergic reaction, the staff there and that particular participant should be prepared for that possibility. One of the Alaska cases, healthcare worker, was a middle-aged woman who had no history at all of prior allergies. So that's a little bit concerning, and we're going to have to follow this out. In all cases, they were able to quickly overcome this with appropriate therapy, but we need to monitor this very closely. One of the reactions is called anaphylaxis, and that is really potentially a very severe, life-threatening reaction. And people generally will know that, where they'll have, in addition to maybe a rash, they'll have difficulty breathing and other manifestations such as their blood pressure lowering, et cetera. So anywhere where we're going to administer vaccines, we have to be prepared for that inevitability potentially. And as such, because these severe reactions usually occur within a short period of time after they're vaccinated, we have 2 guidelines already. One is to wait for 15 minutes at least for those that have had minor allergic reactions in the past, and even longer out to 30 minutes for those that have had any history of anaphylaxis. So I think it's an interesting phenomena, and it was not seen either in the large Pfizer trial of 44,000 enrolled or in the Moderna study of 30,000 enrolled. So this seems to be 1 in a million right now, if you calculate that out. But nonetheless, we need to follow this carefully. Pfizer by the FDA has been charged with watching and recording this, and we'll find out a little bit more. Now, there are several components to these vaccines, but both for Pfizer and Moderna, they're constructed in a similar way. They carry the messenger RNA, which we all have in millions of.
Oh,
The-
looks
the-
like you
sorry.
froze a little bit. You were just talking about they both carry the messenger RNA.
Right. So we don't think that's the culprit because we all have that in our own bodies. And this extinguishes relatively quickly after the administration of the vaccine, because people have been concerned that that is also a genetic code that might stay with us forever and ever, but that is not the case. It could be, and this is the major point for immunologic protection, that is, we chose one component of this vaccine called the spike protein. For those of you, many of you have looked at pictures of the coronavirus and see these little projections from the surface. That's the spike protein. That's the very site which binds to our own cells and initiates the whole process. So the immune response is directly against that. We don't think that's the case, but that remains a possibility. And there are certain preservatives in these vaccines that will be investigated as well. So we don't know precisely what the culprit is right now, but the companies are all charged with looking at this much more carefully and with more data to look at it in terms of the numbers of folks given the vaccine.
Dr. Dougal, I have a question from a lady who says she had COVID also in October. So she says she's no longer contagious, and she's been told that she and her husband now have immunity for at least a few months. But she wants to know, how safe is it for us to have someone over for dinner?
I think the one thing we have to remember is that once we do get infected, there is going to be some degree of immunity. What that immunity is going to be very variable. So it does not mean that you are completely safe if you have been infected. The safest thing to do right now is to continue doing what is recommended for everyone. So social distancing, making sure that you're masked, making sure that you're not gathering with people who are not in your family, immediate family, are all things that are important as we continue with this. At this point of time, we don't have enough of an understanding where we would say that once you have been infected, that you're not potentially going to get reinfected at any point of time. And also, once we do putting our guards down, the risk of mingling with one person versus many really starts increasing the risks for those individuals too. So I think right now we are in the throes of this. This is really a serious pandemic still, and we should all be very cautious as we move forward.
So this is the same answer for the person who said a coworker had COVID and is no longer wearing her mask. Bad behavior.
Bad behavior. I think it is one of those things that we need to be socially conscious still. Even if we do get infected, this is not something that's kind of a free pass for us. We need to make sure that we adhere to all the safe practices that have been put into place. Social distancing and masking are still very important. As we are getting immunized, again, this is not something that everyone's going to get immunized in the next 2-3 weeks. This is going to be a long process. As we are immunizing people, we cannot forget the basics. Masking and social distancing needs to continue if we are going to beat this virus.
All right,
And
Dave?
can I add, Monica, a few things, please? One is that there are studies at points in time when they have undertaken culture for virus once somebody is initially found to be positive. And for most people that are non-immunocompromised, that period of time is where they could still shed virus and be infectious to others. It's on the order of 7 to 8 days. But it is longer in immune-compromised individuals. And right now, the CDC guidelines say 20 days before one would be considered recovered. But I do agree with my colleague that we should not let up our guard. And just to point out that it will probably take vaccination of about 75% of the US population before we get to the point where we have so-called herd immunity, which means that we would be safer than to remove some of these infection control practices. The last point I want to make is people have been really worried about the so-called twindemic in this season coming up with both influenza and coronavirus, with symptoms that may be often overlapping and indistinguishable. So one of the things that I consider, if you will, a silver lining from all these measures that we're taking is if you look at the Southern Hemisphere, and they just passed through their winter season, they had very few cases of influenza. And we, so far in our season in the Northern Hemisphere, including Europe, have seen the same thing. It's early in the season, and we will be doing testing, I'm sure, at all three of these institutions for both, because we do have a medication called Tamiflu that can be given especially early for influenza and change the course of things. But I think it's going to take longer before we abandon these practices that Dr. Dougal has spoken about, and I agree with that. So many reasons as well to get your flu shot if you haven't gotten it yet, in terms of what we're seeing, even though the occurrence of influenza so far is relatively low.
I love you sneaking that in there. That's awesome. So,
Always,
Dave,
I'm doing it for you, Monica.
Oh, we hear it all the time from her. Monica can never say that enough. All right, Dr. Ratner, I want to get back to a kind of a COVID fatigue type question for you from one of our viewers. There seems to be a lot more fighting in my house now involving my kids. Everyone is at their wits' end. I'm trying to be supportive, but behavior is just out of control. What can I do because of all this COVID?
Stay calm. Now that is very hard to do, but I know this is complicated. I also know there is no one formula fits all, because every family has a different dynamic. Every family has different amounts of children, dynamic between the parents, the ages, size of the house, how much space there is for people within that house, whether the kids are in school in person or are Zooming from home. There are so many variables. There is no one size fits all. But when I thought about what I might say if that question came up tonight, which for sure it did, was really, I decided to point toward the parents themselves, the adults, because I really truly believe, and I think I have, there's research to support it, is that we, the adults, we set the bar for our children. And I include adult children in that too. Parents and adults set the bar. If we stay calm, if we manage our own anxiety, when we role model for our children what we want for them, that is critical to opening the door to help our children. So if we want our children to stop fighting with each other, we need to make sure that we're not fighting with our spouses or fighting with grandma over the phone or with a coworker. Again, we have to role model. So it really, really starts with us. And from there, and that's where I'll circle back to the mindfulness and meditation, and there are many other self-care things we could do. But whatever that self-care is for us, we must engage. Our children are watching us now more than ever. They are watching us. This is our opportunity, right? And I love that Dr. Salata talked about the silver lining. There are silver linings that we must continue to find if we can. I know it's not always possible, but for every one of us, for better mental health, and again, it is about shifting that mindset. What are some of the silver linings? We do have more time than ever with our children. Yes, it's challenging, but at the same time, we have an opportunity to have more influence that we might have over them had this pandemic not hit. Let's use these as opportunities. And I know that I'm only touching on it, and there's more we could talk about, but that is really a seed I'd like to plant in people's minds to empower all of you who are watching and beyond, empower you to do what you need to do, because it starts with us. And when we give ourselves what we need, then we can give it better to others.
That's a great answer. Now we all have to put that into practice. Dr. Salata, I'm gonna do a rapid fire question at you. I have a number of questions from people who are pretty much yes or no answers. Linda wants to know, with more than one 2-dose vaccines now soon available with Pfizer and Moderna, do you have to get the same vaccine for the second dose? And how do you know which one you'll receive?
So that will be told to you up front. And the answer right now that's being recommended is you stay with the same manufactured vaccine, because it hasn't been studied.
Oh, he froze again.
Uh-oh.
I think
Whether or not these are
There he is. He's back.
that may come into play later based on supply and demand later. You might have the option of actually picking which one you want based on several things that people will be educated about. But we are not advocating that they switch from one manufacturer of vaccine, say Pfizer, to the Moderna vaccine, although theoretically that might work. And I would only point out there that one of the other challenges here is getting people back for their second dose, right? So it's 3 weeks in time from the Pfizer vaccine, and it's 4 weeks after the Moderna vaccine. AstraZeneca will also be 4 weeks in between. And when we get to the Johnson & Johnson product, it will be a single injection. So some people might favor that. The other advantage of the Johnson & Johnson vaccine is it needs to be kept only at refrigeration temperatures rather than the ultra low temperatures that we see for Pfizer. But Pfizer has been also genius in terms of how they approach this, in that they have these pre-packaged storage units where the vaccine is placed inside and then covered with dry ice. That can be kept in the regular freezer of your refrigerator or wherever for up to 15 days. So it's not as onerous as we first imagined, because that's the same temperature that is in place at the South Pole, believe it or not. So with that in mind, it's going to be some choice eventually, but that's when we have a sufficient supply of the vaccine. Right now, it's going to be in the prioritized fashion of vaccinating people whenever we have. But we're trying not to interchange the vaccines for what I indicated, but it may come to that in the future. So there are going to be a variety of different types. I mentioned the Johnson & Johnson. We mentioned AstraZeneca, which is a very different type of vaccine. It is a chimpanzee adenovirus. We all have exposure to adenovirus, which can be one of the causes of the common cold in humans. But this has been modified, attenuated as such, to the point where this does not replicate in humans at all. And then they have contained, because it's a large virus by itself, the adenovirus, certain genes of the coronavirus, and that's how it's delivered, as opposed to what we talked about with both Moderna and Pfizer. So we'll have to look and see. The one thing that stands out so far with the AstraZeneca vaccine is that the overall efficacy, mainly from vaccinated individuals or placebo in the UK and Brazil, has been on the order of 70%. And that is lower than what we've seen with both Moderna as well as Pfizer. As we're vaccinating again in the US and have much larger numbers, we'll see if that holds up or not. But there was kind of an accident made with the AstraZeneca vaccine, in that the wrong concentration of the vaccine was initially delivered to sites. And therefore they got half the dose initially and then the full dose secondarily. And that level of protection was 90%. But when they looked at somebody that got 2 full doses, it was only 62%. So we need to understand this more. And as I said before, in my view, the more vaccine we have available from different manufacturers will be critical when you consider the shared numbers and also global distribution of the vaccine too, particularly to places that are considered resource limited and don't have the capacity. They have capacity for freezing in the compartment of a refrigerator, but doing beyond what we are doing for the Pfizer vaccine will really be an issue. There's also the cost among vaccines. The highest ticket right now seems to be Moderna at around $25 to $30 per dose. That's not that much. It's around 15 to 20 for Pfizer. And we don't know where AstraZeneca will come up, but they think it's going to be $10 to $15. So it'll be a bit cheaper. They think their vaccine will be more suitable, that is the AstraZeneca folks, for distribution globally, particularly in the resource limited areas of the world.
And I just reported yesterday that the CDC is telling people that vaccine administrators may charge to give you the vaccine. But likely if you have insurance, it should be covered. And if you don't have insurance, there is a fund that will help people pay that fee. Dr. Dougal, I have a question from someone who already has COVID. They right now they have mild symptoms, but this person wants to know, what can I do to ease my concerns about my mild symptoms becoming something bigger? Every time I cough, I get anxious that the virus is about to get worse.
So I think what Dr. Ratner was talking about before in terms of being always calm and being mindful are two important things to be applying when you have been infected with this virus. So I think that's number one. Now, concerns about things worsening is a valid concern. So you need to be very mindful and watchful about things that have been shown to be associated with worse symptoms. So we know that this virus, it has a bimodal symptom onset, like where we have the initial infection where people will kind of develop some symptoms for the first 3 to 5 days. A lot of people will kind of start improving, and around day 8 to 10, you can see a second spike where patients can develop severe symptoms, which could be high fevers or the development of respiratory symptoms coming in. So I think one of the key things is as people get infected with this, they need to be very mindful in terms of if they start developing symptoms which are concerning, high-grade fevers, cough that's concerning in terms of they're not able to finish sentences, if they have an oxygen saturation device at home, if they see that their oxygen saturations have started dropping, then those are concerning factors that they need to let healthcare professionals know about right away. Outside of that, I think just as you would take care of yourself in any viral illness, rest, eat healthy, and just be calm. Those would be the key things to remember. One thing to also remember is that different age groups do respond differently. So people who are of a higher age group seem to have worse symptoms, especially when it comes to delayed onset of symptoms. So individuals who are over 60 years of age, if they're developing these delayed symptoms, should let their physicians know about development of those symptoms. And again, special populations, immunosuppressed patients who have other underlying disease and other comorbidities need to be more mindful about this. And if they do find that anything's changing, they should touch base with their providers.
Okay, great advice. Dave?
This one just came in on text for Dr. Ratner. What are your recommendations for a person who basically is solo during the pandemic, living alone, no kids, working remotely, and now social activities canceled? It seems like all the resources are geared to the switch of families being home and kids not at school, and the solo group, as this person put it, seems lost.
So that is an excellent question, and I've seen people do different things. I've seen many people who solo get pets, and they've enjoyed that. And I know that's not a possibility for everyone, but what's been nice about getting a pet is it gets people out, it gets people walking. So for people who are solo, I suggest that first of all, get outside and obviously in a COVID-friendly way, get some fresh air, go walking, just, just even seeing people from 6 feet away and waving at somebody in the park from 6 feet away. I mean, just having that interaction can be incredibly helpful. Even going outside and seeing birds flying, that it's just a sense of connection to nature has been, has been shown to really be an uplifter for people. I also want to recommend to people who are really truly solo is to, there are some support groups that are going on right now. They are on Zoom, and I know people have some Zoom fatigue, but it can be beneficial for people to connect with others, even in a support group, or meet other people if you really don't. The other thing, and this is something that I spoke about in recently on a news report as well, was about volunteering. There are COVID-friendly ways to volunteer right now. There are a lot of people in need, and there are a lot of agencies who have found ways to engage people in volunteering opportunities to help others. And I think we could, it's not hard to find those resources. Greater Cleveland Volunteers, you can, if you go on the website, they'll tell you exactly how you could do it. Volunteering has shown to improve mental health and really help people, especially those who are alone right now, to find meaning and purpose. And it is through meaning and purpose right now that we can grow from adversity. That is very, very critical at a time like this. So I hope that this can at least give a bit of a sense of some of the ways that there are opportunities to do that.
That's great advice. I just gave my best friend today some organizations that were looking for volunteers.
Oh,
so
great.
That's really great. Dr. Salata, can you get COVID from the vaccine?
Absolutely not. This is not a live or attenuated vaccine. That approach with a attenuated or changed or modified vaccine is the very way that they're developing vaccines in China, which are not being tested in the United States. But this is either a piece of the virus or some of the genetic code of the virus, but it's not live in any way. So the answer is no. Can you develop symptoms after vaccination that are flu-like and could be consistent with the possibility of having COVID? It would be very coincidental at the time of that initial dose to have been incubating, if you will, the coronavirus at the same time, but I can't rule out that possibility. What distinguishes the side effects from the vaccine, and both of them being put forth have them, is the flu-like illness and the soreness at the site of the injection that really last at most 24 to 36 hours in most cases. And after that, if you have symptoms that continue, it's possible it could be COVID, it's possible it could be another flu illness. So that would have to be discussed with their primary caretaker and escalated as appropriate. So the bottom line is it is not associated with developing coronavirus in any way possible.
On that note, though, if you are vaccinated, can you still get the virus and spread it around?
So the answer up front is yes. Remember that there's a 95% protection rate, but even among those that receive vaccine, 5% of those develop breakthrough disease despite the vaccine. And that's another reason to continue these measures that we've been talking about. The other question that often follows on the heels of what you asked is the issue that even after one single vaccine for Pfizer, there's already a 54% protection rate. If you receive two to maximize their immune response, that's where we reach the 95% level. But there were some that had disease that is COVID, even in the context of being vaccinated. So we have to factor that in. But that seems to be a less likely phenomena. The other question this begs is whether people who have had COVID in the past should get the vaccine, right? And the current thinking about this has not been finally firmed. But I think most experts around the country, including the CDC, feel that eventually those individuals should be vaccinated. We have a precedent for that in other scenarios. For instance, some of your viewers may be familiar with shingles, and the current recommendation is even if you've had shingles before, you should be vaccinated for that. And we know that there are cases of reinfection, sometimes with a genetically different virus, that would protect that, by getting the vaccine. And also, if you look at the early studies, including from both Pfizer and Moderna, that have been published in the early stages of testing, the protective antibody responses are 10 to 20 to 30 times higher than we see with natural infection. And the other arm of immunity that is being evaluated in these vaccine trials is something called T-cell immunity. That by activating that arm of immune response, that can in turn help make more and better and longer lasting antibodies. So among other things, we also know viruses can be directly killed by T cells. So we think that the combination of antibodies and also T cell responses will be helpful. And my opinion, as well as many other experts, is that we will be offering the vaccine to those that already had COVID, but probably want to put them lower in the line because they've already had COVID, and it will probably be protective for them for at least a while. And if somebody has active COVID right now, their current recommendation is probably to wait at least 90 days after that illness before considering if they're in the priority groups getting vaccinated as well. So,
Dr. Dougal, Dr. Salata mentioned shingles, and I had a question from a 70-year-old person who wanted to know that if she's going to get the COVID vaccine, she's also due for the shingles vaccine, and she wanted to know if it's important to spread those out.
So I think whenever you get a vaccine, you don't want to be mixing, just because if you're going to have a reaction to something, you might not know which is the offending agent. So I think it's always a good idea to kind of space them out a little bit, not because your immune response is going to be any different, but in terms of the side effect profile. If something were to happen, it'll be easier for people to understand temporal relationships, and then that might help us just kind of deal with things if something like that were to happen.
Okay,
and
Dave?
Monica, if I could add, sorry, now we'll go over to Dave.
No, go ahead.
In the studies, let's take influenza vaccine as an example. If somebody already had just received it, we would not offer them the coronavirus vaccine for a period of at least 2 weeks. So that was for some of the same reason that Dr. Dougal mentioned, but it's not been studied yet in terms of this. And generally speaking, except when we're faced with somebody in the past who had traveled and needed multiple vaccines, there is some guidance about which vaccines you can give together and which you don't. But I would agree with my colleague in terms of trying to separate if you can.
I just looked at the clock and realized we only have about 3 minutes left. So what I'd like to do is kind of do a round robin. And I'm going to start with you, Dr. Ratner. Final thoughts, what you really want people to take with them from this forum, and how we can get through this holiday season. And Dr. Salata and I were just talking yesterday that I keep telling people, trust me, this time next year, we're going to be really close to being back to the normal we all know. Maybe not completely normal, but pretty brighter days are definitely ahead. What do you want to leave people with relating to their mental health and coping mechanisms to get through this time?
Yes, I guess my message to everyone is just we do better when we work together. And it starts, again, as I've reiterated tonight, it starts with ourselves, taking care of ourselves. And from there, and being and finding ways to be at peace and calm with ourselves, then do it with our children, our spouses, our families, our communities, and our country, and then for the world. We are going through this together. We have been incredibly divided, and that divisiveness has really taken a toll on our mental health. And each one of us is responsible for ourselves, because when we pass this dark cloud, we want to be able to look at ourselves and see us and look and say, wow, I handled this. I handled this in the best way. I want you to think about looking back and saying, I'm proud of the way I grew through this really challenging experience. So let that be your mantra and the way that you hold yourself up and be an example, be there for others, and we will get through this. So that's my blessing. And as well, please seek support if you need. We are here for you. Metro Health has a COVID hotline. We have mental health professionals. We are here for you. You're not alone.
That is so valuable. Dr. Salata, I have like 27 million other questions and so I just want people to know this is certainly not the last forum we are going to do. We will get you answers, as I've been reporting every day, but what final thoughts do you want to leave people with? Because I know one of them is, as soon as you're able, get the vaccine, correct?
That's exactly the point. Because there's a segment of our population that really is resistant to that, and they're skeptical. So I think though the term Operation Warp Speed to some is inferred that we are cutting corners to get to the point where we're at now, but far from that. There's a coin that a phrase that I use, call it, we're moving at the speed of science. And I think that should be reassuring. And these vaccines have been evaluated not just by the government, but by independent experts to make sure they're both safe as well as effective. Now, you should know that we are going to study, at least in the Pfizer and the AstraZeneca vaccine that I'm involved with, our vaccine candidates for a longer period of time to look for late occurring side effects and durability of immune protection. So rest assured that we're going to continue to follow this. We didn't even talk today about whether or not we'll have to have boosters in the future, et cetera. We could save that for another time. But I think this is all going to mean a major educational blitz that's sincere, that people will find believable. And you're right, Monica, we should push for the vaccine whenever possible. The latest polls show that an increasing segment of the population are going to receive the vaccine when it's their turn. But there's still about 20% of people that don't. And going back to Dr. Ratner's point, I think we have to think about protecting ourselves, but also our communities by doing this, and also the population globally. So that would be my message to people as well. Trust the science.
I think it's pretty safe to say all of you are going to get this vaccine when it's your turn, correct?
Yes.
Dr. Dougal, you are the one who you see, honestly, the worst of the worst, because they're coming into the hospital and not being able to deal with this at home. What do you want people? I tell people all the time, please respect this virus. This is something we've never seen anything like this before. And you talked about how it has a modality where you think you're getting better, and then it hits you like a truck again. What do you want to leave people with? And especially relating to, we're so concerned about overwhelming hospitals. What message do you want to leave everyone with?
I think two things. I think the first thing is, like you said, this virus is not something that we are very comfortable with, because we've not seen anything like this before. The sheer number of patients that we're seeing with disease are such that it does overwhelm the hospitals, right? So one of the things to remember is that if you're getting an increase in number of COVID patients, that has an impact on our ability to really provide care for other diseases, because if your resources are now completely being consumed by patients who are getting infected by coronavirus, our ability to really provide usual care is going to get impacted. So one of the most important things for us is that we need to get a handle on this so that we can provide other factors in terms of the usual care for patients. So that's something that everyone definitely needs to be mindful of. The second thing is it's been a tough year. Like we started off like March is when the first surge really hit the US. We're hitting like 9-10 months of this. People are tired. Healthcare workers are tired. Like my colleagues, nurses, physicians, they've been working tirelessly through all of this. But the key thing is we need to work as a team. We need to stand there for each other, and both support for mental health and support of just usual social norms, but also like we need to take social responsibility, where if we do see something that has the potential of harm for anyone else, we need to learn to speak out about it. And we need to have forums like this, because I think what we'll realize is that these are things that are hard for everyone, but if we work together, like we will kind of get back to normal pretty soon.
And on your behalf, I also want to tell people that please, if you are dealing with any other healthcare issues, such as, heart problems or stroke symptoms, do not hesitate to get to the emergency room, because I've seen what you all do, and I know firsthand that hospitals are the safest place you can be right now, because you all know how to handle this virus better than anyone. So I want to tell people, please, we saw this during the first surge. We don't want to see people dealing with other issues that could be prevented. So if you need to, please, please, please get the help you need. Dave, I'll leave you one more final thought before we wrap this up. Anything from you?
Just thanks to all three of our great medical professionals for joining us, taking time to really provide answers. And Monica, I agree with you. We're not done doing forums like this, because there are always going to be more questions that need to be answered. And it's great that the professionals are available to join us.
And that's what's so amazing about this, is in the coming weeks, we will have more answers to so many other questions. And I know I talk to these people pretty much on a daily basis. So I can tell you, we're going to do our best to stay on top of this. But to our panel, I cannot thank you enough for all of you are doing this from your homes. And I'm so grateful for you to take the time to help educate our viewers. And this, of course, will be archived. So we'll be able to pass it along and share this information, and hopefully it will never become dated. So from that perspective, I'm wishing everyone a happy and very, very, very healthy and safe holiday season. Thank you all so much for joining us, and I'll see you on the news tomorrow. Dino, back to you.
Night, everybody. Yeah, thanks for watching here at WKYC.com, Facebook Live, YouTube, and of course our WKYC app. Have a great night, everyone.
Good night. Thank you.
Good night.
Thank you.
Thanks, guys.